BENDT Transitional Care is a short-term rehabilitation facility that strives to keep seniors active and in their homes as long as possible. We focus on rehabilitation and skilled nursing from folks that spend time in the hospital and need a place to come in a post-acute setting to rehabilitate. This building is equipped with a 3,000 square foot rehabilitation gym that is designed as the focal point of the facility. Wide open space and the ability to provide service to those patients that weren't able to really gain access to tools that were needed for their rehabilitation. We also designed this facility to have rooms specialized for patient needs. Bariatric rooms, infection control rooms with negative pressure, so that we can take on new diagnoses and treat illnesses that hadn't been treated before in a post-acute setting.
So I oversee all construction for Avamere. So I was the owner, the person at the ownership, responsible for working with the city, the architects, our development team, all the contractors, and getting this building from a raw piece of dirt to a finished building. Well, first we had to find a piece of land that was suitable for this development. There's not a lot of land that's vacant, and that you don't have to redevelop something that's already there in Bend of this size. Location to a hospital, other medical facilities is very important. And we're only about half a mile down the street from the hospital, so that was kind of the first hurdle, was finding the right piece of land. Next was this land was not zoned properly for this development. So we did do a zone change with the city of Bend. Went very smooth, took several months, but we got through the process. Then we submit plans to both the city of Bend and the state of Oregon, since the building is licensed as a skilled nursing building. Process takes about 4 to 6 months to get permitted, and then it takes about 10-11 months to build the building.
We invested a great amount in developing both hardware and software that is accessible to our caregivers. From in-room charting to electronic charting in the dining room, we're able to have a person's point of care at every angle in this facility. This building is equipped with wireless internet throughout the facility, where physicians, if they were to come in and needing access to their electronic medical records, they'd be able to get on at any point throughout their facility experience. Also, with the ability of point-click care, they're able to see their patient records remotely. The most exciting thing about this project is I have the most incredible staff that you could ever imagine. We've been in a building that hasn't been touched by a contractor in 20 years. Last year we had a deficiency-free survey. Our patient outcomes, our customer outcomes are some of the highest that I've ever seen working in this industry. My staff care. They deserve this building. The population in Central Oregon deserves a place to come to rehabilitate in an area that is comfortable, that is safe, that is going to meet their needs and hopefully exceed every need they have. That's what excites me, to provide a place for my staff where they can come to work and feel proud of where they're working.